Functional series number 6 is our card series. We're going to show you several different options that you can do to incorporate your weak arm into function. The first one that we're going to do is Stacy and I have a deck of cards. We split it in half, and what we're going to do is we're going to place that deck of cards in your weak arm. We're going to work on that first, giving that hand a job, placing those cards in the weak hand. And again, I know I keep repeating myself, but these could be completed seated, and I want you to consult your occupational therapist in ways that this activity could help benefit you as you continue to recover. So as we place those in the hand, all we're going to do is we're just going to simply flip those cards. So we're just going to flip the cards with our uninvolved hand. So Stacy's holding them in her right, and she's just going to flip. And the great thing about this is that we're giving some input to the hand, we're giving it a job, we're asking it to do something. And as we're doing that, we're going to flip, so we're using 2 hands in this activity. As that gets a little bit easier for you, what Stacy's doing, what I really like as I looked over here, is she's using her thumb to slide that card over. Which this is a great way, and what's great about these cards is they slide. So it makes it a little bit easier for them to move, and it makes it a little bit easier for you to produce movements. So Stacy is doing a great job with that, and she's sliding them away. That's great. Well, that means that we're working the right muscles, which is nice to hear, and we're going to keep flipping. Now, how many repetitions you do is going to be up to you. As you start to fatigue, you can stop, or you can take a rest, you can pick it back up. We just want you to keep moving, and we want to get your hand involved in exercise. So that's the first way that you guys can get your hand into function. The second thing that we're going to do is we're going to put the cards into the strong hand, so the weak arm is going to do the flipping. So we're just going to practice. And again, whenever you start any of these series, just get comfortable with the cards, get comfortable moving, excuse me, maybe relax a little bit. So all we're going to do is we're going to flip, and we're going to turn those cards over. So I initially flipped in, Stacy flipped out. I like that. So we're going to do that both ways. So keep flipping, Stace. You brought them out away from you. Yeah?
I have to pause and think about which steps I'm doing.
And you know, that's a great thing that Stacy pointed out, that she has to stop and think. We are not in a race. I want you to go as slow as you need to if you have to think about it, because we're working on that coordination. We're trying to build that coordination back into our hand for all those functional tasks that we need to do. And with the repetitive movement, this is a great way. So what I'm going to ask Stacy to do now that she's looking great with that is I'm going to ask her to flip towards herself, so we could show you an opposite way. So now you're going to flip them towards you and place them down. So again, just simply working with this deck of cards, you are working with your fingers, but you're working your whole arm. Stacy's working her arm.
And my brain too.
And her brain. And you know, and we want to do that. We want to incorporate all these activities so we can strengthen all areas that need to be worked on. So she's doing a great job with that. What I'm going to have Stacy do now is I'm going to have her back up those cards. And I am going to make her work her brain a little bit more. Depending on what you want to do, you can either separate them into colors, or you could separate them into suits. And the cool thing about that is you're going to flip them up, you're going to take a peek, and then you're going to place. So if you want to do red and black, that's fine. If you want to do red and black at home, that's fine, or you could put it into suits. So you're going to take the next one.
Red and black.
We'll do red and black. Perfect. That looks great. So now we're not only adding in the movement, we're adding in having to think about where we want to place the cards. The other thing that we could add into this, I'm going to let Stacy do a few. And that's why it's nice to consult. It's nice to ask where you should be in your rehab. But I know a lot of times we want to work on speed. We want to move a little bit quicker. This would be a great way to do that too. In a couple different ways, we could do it a couple different ways. I'm going to have Stacy, when she's ready, we're going to pick up those cards. And I typically recommend that you try the easiest first, and then you build up from that. So what I would tell Stacy is if she wanted to work on speed, I would just have her work on just flipping. I wouldn't have her focus on putting them into red and black. I would just have her work on flipping. So she's just going to flip the cards as quickly as she can. And what you could do If you wanted to show improvement, is you could use a timer. So you could say, okay, it took so long to do 52 cards this day, and maybe in a week it took you less. But depending on where you are in your recovery, that might be something that you want to work on, and that's a great way to show progress. So you're going to flip as fast as you can, and then like Stacy said, if you wanted to add that little cognitive piece in there, you could flip as fast as you could, and you can also put in putting it into suits and putting it into colors. That is a second step. So I am definitely an individual that likes to see numbers. So I probably would be one of those individuals that wouldn't mind timing to see how quickly I could do something and then to show the gains.
It'd be good to have goals to work towards.
You know,
and so show improvement too.
That's right. You want to set goals for yourself. You want to show improvement. That looked great. So a couple other ways that you can also incorporate these cards into function and to use both hands, depending on if you've had any visual perceptual deficits, which would be something that you would talk to your therapist about, is you can spread all your cards out and you can use two hands. So I'm going to have Stacy spread the cards out. And if Stacy had the full deck of cards, or if you wanted to split them into suits, you could try to find them by suits. You could try to find them by color. I could say, hey, Stacy, I want you to look for 6. And you could work on some visual scanning. You could work on picking them out with your hand. So I'm going to tell Stacy whatever she would want to do, she can. So I'm going to have her try to find the ace of spades and the 4 of diamonds, and I'm going to have her grasp them out with her right hand. So again, you're having to do that visual scanning.
So ace of spades, you said, and
yeah.
Then ace of spades, but I don't remember the second part.
You know, I don't either. How about we do the king and the hearts?
King of hearts.
The king of hearts.
Okay, king of hearts, okay.
And last but not least, you can always play a game of cards. So if you want to play a game of cards with your friends and family, that would be a great way to incorporate your arm. Have fun at home.